Welcome to How to Be an Effective Advocate for Your Specialty. My name is Larry Green. I'm a dermatologist in the Washington, D.C. area, and I'm honored to be here and start the Aesthetic Water Cooler series. This is our first podcast, so I hope people listen to it once it's archived, and we'll talk a lot about being an effective advocate for your specialty, which in our case is dermatology. Before we start, I'd like to thank Equa Marketing, who is sponsoring this water cooler series. Equa Marketing provides search engine optimization services and digital marketing services for dermatologists. So I really want to thank Equa for making this happen and letting me come here and talk to you and everybody and talk about why it's important to be an advocate for our specialty. So let's start with that. Let's go into that. As dermatologists, we face so many things every day that threaten our practice. The way we want to practice, our patients, how we practice. There's much going on in the realm of dermatology that can be perceived as threats. And I'm going to talk about some of the things that can change the way we practice, and that I think is important, not to put your head in the sand, but to be active, because the more active people we have, the more likely we are to be able to change things. There certainly is success in numbers, and numbers are very important. When you think about it, the trial lawyers have a huge association, and they're very successful when it comes to legislation and getting what they want done. They also have a lot of people in who are legislators, but that shows that they're very active people. So this is why, if we don't do something, and Brett Caldiron, a dermatologist in Ohio, always said, and I'll use his words. He says, if you aren't at the table, you're on the menu. And this is very true, I think, when it comes to being a physician, specifically being a dermatologist. People are always trying to alter, like I said, the way we practice, and we want to be able to help change that or foment change, or at least be a participant. If you're not a participant, you're not there, things will get done to you. And that is the doctor's reputation for years and years, that they're not very vocal, that they're not participating. And things for years and years have been done to us. And a lot of that has to do with some of the positions that we're in these days and the positions that we face. So I really want to encourage everyone, all dermatologists, to be active. To be active and to do things. We're going to talk about ways to do things over the next few minutes. But don't just put in shift work to work your day and see your patients. There's much more to our specialty, to being a physician, to being a dermatologist, than shift work. So let's talk about a few of the things that are affecting the way we practice today. Okay? There are things that affect our patients, how we can help our patients. Things like having to do step therapy, meaning when we write a prescription, we have to show the patient has failed a certain therapy, one we may not appreciate and want to do. We think another therapy is better. Well, the patient's insurance company or PBM, pharmaceutical benefit manager, thinks that their choice is better. They want to limit what we choose because they have a better deal on another product, a better pricing deal. So that's something that we do every day that affects our patients. Prior authorizations is something we do every day that affects our patients. More and more, every medicine, even generics now, require prior authorization. That's more paperwork for us, more time consuming, and a lot of times they're denied anyway. So step therapy, prior authorization. What about prices of medicines? Medication pricing is going up and up and up, including generic medications. This is something Congress is starting looking into, people know about. State legislatures have looked into it. Here in Maryland, the state I live, outside of Washington, D.C., the state's attorney general has been looking into it, trying to limit price gouging on generics, and that's actually because of a bill that we in Maryland worked on him with. So we put that in his head. But prices are out of control. Our patients cannot get the medicines that we prescribe for them. And that's a problem as well. So That's an issue about the way we practice step therapy, prices of medicine, prior authorizations. And then there are things such as the tanning industry, which as dermatologists, we speak out against. We don't want people to go to tanning beds. We don't want people to tan as well. We know they're dangerous. We know they can cause skin cancer later in life for these people. We certainly don't want minors to tan. We like kids to be able to have sunscreen applied in school, be able to apply sunscreen on themselves in school. So that's sort of like a white hat issue, but also has to do with the way we interact with our patients. So those are things that face us every day, and that if we don't do something about, things will be done for us. If we don't try and halt step therapy, well, the insurers and the pharmacy benefit managers will impose their will, and we'll have more and more step therapy issues, and we'll have double step therapy, triple step therapy, and to the point where the pharmacy, or the insurance carrier is choosing medication, not us dermatologists. Pricing medication, if it keeps going up and up and up, all of our medicines, none of them will be covered. Even generics won't be covered. More work for us, more paperwork for us. And if we don't do anything to help limit the tanning industry, for example, what's going to happen? The tanning industry will make more money. You know, we could say in a way, and this is very sort of crude, that it's good for our business. Let people tan, get more skin cancer. But we as dermatologists also want to be promoting safe behavior for our patients. That's our job. We're what people trust. So it's something I think it's important for us to promote, not when we talk with patients, but to promote on the whole as a public health issue. And that's a public health issue. What are things that face us? Forget about, besides what happens with our patients and things that affect us and our patients. What sort of things do we deal with on a day-to-day basis that come to us that can limit the way we practice medicine? Well, the first thing the trial lawyers are always trying for, every year in the state of Maryland, they try it, and they try it in almost all states, I'm sure, is to enable more malpractice lawsuits to proceed easier, to call expert witnesses that are not as qualified to be able to do that. So those are the things that the trial lawyers try every year in Maryland, and I'm sure they try it in most other states, that if we're not there to do something, this is not just a dermatology, this is a medicine issue, a house medicine issue. But if we're not there to do something, they'll have their way. Why not allow any experts? So say we perform a doctor dermatologist performs Botox and something is not the way the patient wants. Why not have the expert lawyer be an obstetrician who's doing Botox? That can be the expert. Well, if tort lawyers have their way, they'll be able to sue for $5 million, $10 million, whatever they want without limitations for pain and suffering or whatever it may be. Then have an expert who will be considered an expert who really isn't an expert. These things are happening, and these things will happen if we're not advocates for ourselves. Speaking of obstetricians, what about scope of practice? We have people, everyone wants to be a dermatologist these days. We have people, dermatologists, doctors, non-doctors, nurses, PAs, estheticians. Everyone wants to be a dermatologist. Everyone's practicing dermatology. We have emergency room physicians, obstetricians, internal medicine doctors, family doctors, all practicing dermatology without being board certified in dermatology. Should we let this happen? Is it okay? Is it safe for our patients? Is this a public health issue for our patients? We're not trying to do brain surgery as dermatologists. We're just practicing our specialty. Why should other non-physicians and physicians who aren't qualified be able to practice dermatology? Again, is this safe for our patients? Should we have some truth in advertising? Should there be, at least for patients, if we're going to have an obstetrician or an ER doc performing botulinum toxin and wrinkle fillers, if we're going to have that happening, wouldn't it be nice if the physician or non-physician display their credentials. A lot of times patients are confused. They don't know. I was talking to a person the other day who was a sales rep for a pharmaceutical company, who was talking about her botulinum toxin and wrinkle filler being performed by a physician's assistant, who she really likes. I said, did you know that physician assistant had 2 years of training after college? She said, no, their training's the same as dermatologists. I said, no, it's not the same. I said, do you know that they don't do residencies in dermatology? She said, no, of course they do residencies. After the training, they do a residency in dermatology. How else would they know to be dermatologists? I said, no, it's trial by error. It's thrown right into the fire. 2 years of training, you're a physician's assistant. You can do anything a dermatologist who went to medical school for 4 years, did 4 years of residency, and then lots of training on top of that, regular CME. You're the same. So the general public thinks that PAs are the same level of education as dermatologists. That needs to be said. There needs to be truth in advertising, or truth in self-representation for the general public, so they learn the differences. They don't know. So those are things that affect us, things that can hurt us, things that affect us every day, that if we keep our head in the sand, like I keep mentioning, and we don't advocate for ourselves, things will get done to us. What are some other things that are happening to us the way we practice medicine? Let's talk about more on a federal level. We're talking more about things that happen on a state level.
I do have a question.
Sure.
For a doctor who does not advocate for their patients right now, for example, maybe their school isn't providing their students sun screen, how would you go about beginning to get into the world of advocacy, speaking up for your patients?
That is a great question. I'm going to cover that towards the end if you can hold on. Yeah, we're going to get into that in the last bit of the conference. If I say it now, it'll steal all the thunder for the last the bit. Is that okay? Can you hold on?
Sure.
Yeah, and if I don't answer your question, then certainly we'll leave time for Q&A at the end. So, but I think it's very important for everyone to get involved. I want to just lay out the groundwork of things that are happening to us as dermatologists, that if no one does something, people don't stand up, no one will stand up for us. It's up to us. Patients aren't going to stand up for us. The lawyers aren't going to stand up for us. The legislators aren't going to stand up for us. No one will stand up for us. So let me give you some examples of things that are happening on a federal level. We have had issues with something called the 25 modifier. The 25 modifier, you guys know, is used to delineate a separate procedure unrelated to the E&M visit, the evaluation and management visit that occurs on the date of service, same date of service. So if I am seeing a patient for acne and they come in, they have a spot that I think is suspicious for skin cancer, that the two are separate services that we should be able to code for checking or biopsying for the skin cancer and treating the acne separately. Well, insurers in New England recently have been saying that the 25 modifier is not accurate and they don't want to pay, if not the full amount, maybe we'll only pay half the amount or a quarter of the amount or no difference for the procedure from the evaluation and management. So in other words, you can code for acne and a biopsy for cancer and you only get paid for the acne or the biopsy, even though they're two separate unrelated things. So you only get paid a portion for the biopsy, because the thought is that working on the acne makes you think about the biopsy, even though that makes no sense. But these are what insurers are saying, and insurers we're not in some states in New England paying for both services in the same day. So that's something that happens, I guess, on a state level, insurer level, I should say, that we need to be vigilant of, is that 25 modifier ignorance, ignoring the 25 modifier. On a federal level, go back to is the 10-day global period. That's something we have back now that we almost lost a few years ago. CMS or Medicare had the idea that our 10-day global period was not being used correctly, and they wanted to eliminate it. For all those who don't know, when we do surgeries say we do an excision of a skin cancer or a skin cyst. When the patient usually comes back not only for suture removal, but we also do what's called an off visit, a minor office visit. The code is 99212. That's code that's billed with the surgical procedure. So in other words, when we bill for a excision of skin cancer or any excision, part of the money that Medicare or insurance pays us is for an office visit during that 10-day postoperative global period. So, and we're the most, dermatologists are the most users of the 10-day global period because those include excisions and intermediate repairs. There are other procedures that are 90-day global. Other surgeons and plastic surgeons do 90-day global procedures. But Medicare was more interested in the 10-day global, which is the dermatologists are by and far the primary users of. So CMS was thinking that we don't bring our patients back. We don't see patients back in those 10 days, and they want to take out that 99212 and take out $35, $40 from, and I'm estimating the amount, but we want to take out money from every surgical procedure we did. So we would make X amount less for every procedure. Well, our lobbying efforts as dermatologists was able to put a hold on that for a while. CMS is now doing a survey to try and see if that's really done, but they were just going to unilaterally stop payments, or reduce payments, I should say, for surgical procedures. If there wasn't an advocacy for dermatology there, that would long be over with. We would be right now paying a lot less for any excision we do. One last thing I want to mention that is sort of on a federal level that we deal with all the time is electronic health records and the macro reporting, the MIPS reporting that we have to do. Reporting to get paid by Medicare without losing money, getting a penalty from Medicare. We have to do extra reporting. And that's something that Medicare wanted to impose a lot more reporting regulations on us. Yes, we have reporting, but it was going to be a lot worse. And that's something, if we didn't have advocacy, that would be something we would have much more vigilant and different reporting. So these are some of the things, let me summarize again, that face us. I mean, I've talked for about 15, 20 minutes already on things that face us as dermatologists every single day, that if no one stands up for us, there's no one else to stand up for us. We'll be part of the meal, we'll be part of the menu. We won't be sitting at the table. We don't want to be part of the menu. We need to be at the table, and that's what advocacy is. So we talked about things that affect our patients like step therapy, prices of medicine, prior authorizations, tanning. We talked about things that legislators or regulators try to impose on us, such as 10-day global periods, reporting for MIPS reporting, the 25 modifier, tort reform. And one thing that's happening now that it may take place that we're currently working on is compounding. There's a regulatory group called USP that's thinking of changing or writing the rights that a lot of legislators listen to, that's writing their own compounding laws. They're a group of pharmacists, and they write the laws for compounding. It may be that we can no longer, the way things are being proposed right now, we'll no longer be able to buffer our lidocaine with bicarbonate prior to using for anesthesia. And we, as you guys know, we buffer lidocaine with bicarbonate to make it less acidic so it doesn't hurt when it's injected. Well, this group USP considers that compounding. We've been doing this safely for 50, 60 years, and there's nothing dangerous. We do it every day. I do it probably 10, 15 times a day to patients. It makes injections of Novocaine, lidocaine much less painful, but they want to eliminate it. I think it's not worry about the pain that it will give more patients. And that's up for being talked about right now. And luckily, dermatology is trying to advocate our piece for that, and it's not done. We're trying our best, but if we weren't there, we would already be, like I said, on the menu. We would no longer be able to buffer lidocaine. Our patients would be in much more pain when we give Novocaine injections. So one more thing I added. So let's move on to the next area. Besides, we talked about why we need to be an advocate. So let's talk about different ways to get involved in the area. Let's talk about the differences, and then we'll talk about different ways to get involved. So I talked about issues that can affect us on a state level, on a federal level, and on a regulatory level. State level is working with the state's legislators, the state's regulatory agencies. Well, not the regulatory agencies, that'd be regulatory, but there are state regulatory agencies. Federal is working with Congress in Washington, D.C., or CMS, Medicare. That's a federal issue that affects all of us. And then we have regulatory. We can be regulated without legislation. The Board of Physicians, for example, and every state has its own Board of Physicians. That regulates the way we practice medicine. The laws in the Board of Physicians are different in every state, but that's the way we practice. And so we have to talk to them. We can be regulated on a federal level by this USP or by the FDA or by CMS or Medicare. That's regulatory agencies. And they can be, like I said, both state and federal. So let's talk, those are the differences of each one. And I think it's important to get started doing something. I think the easiest way to get started is on the state level. So let's talk about that first. Why should we make a difference? I talked about why we should make a difference. We can't do this ourselves. If one person like me wants to make a change, say I'm a dermatologist who wants to make a change, no one's going to listen to me. No one's going to listen to Dr. Green. But if there are 500 other dermatologists in my state, or however many in my state, speaking together with a unified voice about an issue, the state's going to listen. The legislators are going to listen. So that's why it's important for us all to be involved. I cannot do it. Nothing will ever happen on their own. Everyone needs to help and put in the effort in some way, I think, to make the practice of medicine safe for our patients and better for ourselves as dermatologists. So I'm going to tell you about my story and how I got started. And then we're going to talk about how I think we should get involved in each area. About now 15, 16 years ago, I noticed that in the state I practice, Maryland, that many non-physicians and non-qualified physicians were performing botulinum toxin injections, wrinkle fillers, lasers on patients. There were med spas all over the place that had technicians performing laser and botulinum toxin and fillers. I saw patients come into my office who received filler injections that looked awful, or they had side effects from filler injections, or laser, burns from laser hair removal, even laser hair removal. And then I wondered what's happening here? What can I do about this? So I approached a legislator in my state and I wrote a legislator in my district. This is a state legislator in my district. I said to him, look what's happening here. What can we do? He was very sympathetic. He said, well, let's take this to the state level. I'll help you write a bill. Let's see if we can make some changes. But the truth is, I don't think he really expected changes to be made. I was one person coming up to him. He took the time, helped us write a bill. It got dropped in the state legislature. I remember going to the bill's hearing in the House of Delegates many years ago in Maryland. And the bill was heard and nothing was ever voted on and it was dropped. And he said to me, well, the bill didn't have that much support, but we tried. We made them aware of the issue. I learned my lesson. One person can't do anything, no matter how, and then I put a lot of time and effort into it. I can't do it myself. So what's the next step? Work together. What did I do the following year? I went to my county medical society and I went to my national dermatology organization. And in this case, I went to the ASDS, the American Society for Dermatologic Surgery. I told them about the issue. This is an issue that was being faced nationwide, but it's something that's to be done on a state level. be fixed on a state level because it's legislation. It's a practice of medicine. I should say it's the practice of medicine that's regulated or legislated on a state level. So my county medical side, I went and told this to the doctors there. The doctors are part of my county medical society. And I voiced my concern, and they were very empathetic. And these are non-dermatologists. They said, we hear you. We want the treatment with patients with lasers, with botulinum toxin, with fillers to be done by qualified individuals. Plastic surgeons were very empathetic. They were immediately on the same side, our same side. My county medical society crafted a resolution to be heard at the House of Delegates, the state medical society meeting. And if the resolution passes, then that resolution becomes state medical society rule or law. They have to promote it. I had the ASDS help me craft a resolution, my national dermatology organization, very glad to help me. All it takes is calling these organizations up, and they were very glad to help me. No one knew me in these organizations. No one knew me in the county or the state medical society. No one knew me in the ASDS, although I was a member in good standing of both organizations. So it starts, by the way, by being a member. You have to be a member of your state medical society, of your national dermatology organizations. But no one knew me. I just called up. I was a member with a need. They were there for me. And now I had a whole organization behind me, a national dermatology organization, the ASDS. And when the resolution passed, because I had the county medical society support, and they convinced the state medical society to support that, not me. I spoke in favor of the resolution, but it was my county medical society that came to my aid. Following year, we had a resolution passed in the state medical society. It was helped being crafted by the ASDS. And it's now the position of the Maryland State Medical Society to help rein in, for public safety, unqualified individuals performing lasers, fillers, any what we call cosmetic medical procedures. So after working with the state and thinking about legislation, the state medical society, this took another year or two because legislation was difficult to craft and there were not all the doctors could get together because some of the non-physicians who weren't qualified to do it were non-support, like the obstetricians and the ER doctors. But the state medical society was still on record of having supported, so they suggested that I go through regulation. And regulation on the state level is the Board of Physicians. So rather than passing legislation to help stop the practice of medicine or help stop unqualified people from performing cosmetic medical procedures, we went a regulatory way. And we asked the Board of Physicians to hear our. So again, my national medical organization, the ASDS, prepared me when I went to the state board and I petitioned the Board of Physicians. And I went with the plastic surgeons as well because they were on our side. And I went on behalf not only of all the dermatologists in the country and in the state, I should say, with the support of the ASDS. I went on behalf of the State Medical Society. So I went and petitioned the Board of Physicians with the support of all the doctors in Maryland behind me because we had organized all this. And I petitioned to the Board of Physicians to create new regulations defining who can and cannot perform cosmetic medical procedures. Now, what did we petition? Well, I had the ASDS help me craft ideas for regulations and definitions for ideas for regulations. And the Board of Physicians took this under consideration. And the plastic surgeons also testified. It took a few years. I can't remember how long exactly. But eventually the Board of Physicians, on their own, they decided on their own to listen to almost everything that we suggested of them. They realized there was an issue, that unqualified doctors and non-physicians were actually harming people in Maryland, and they felt as a board, they could step in and save patients in Maryland and making Maryland a safer place. So we had no influence on their decision. All we did was present the information. I presented all the information on how what's being done was harmful to patients. I had all case reports and journal articles prepared for me by the ASDS. So we gave the Board of Physicians a lot of information. And the State Medical Society helped me gain information as well. The Board of Physicians made their own decision. And actually, Maryland today has some of the most stringent laws on who and who cannot practice and do cosmetic medical procedures. So it took some years and it took time. But that's how advocacy happens. I myself could do nothing. Myself, with the influence of the State Medical Society, with the wisdom and the knowledge of the National Dermatology Society, was able to get new regulations passed in the Board of Physicians on definition and regulation of cosmetic medical procedures. In fact, a few years after that, I got an email and a phone call. This is very interesting, from senators in France. They saw what happened in Maryland. They saw that Maryland had some of the most safe laws for patients on regulations and safety and who can perform cosmetic medical procedures. They came to me and they said, "Hey, can we talk with you? We heard what you did in Maryland." So they actually came to my office. They wanted me to go to the French embassy. I don't know why. I said no, I was stupid. But I had them come to my office, and I went over the process. And I had members of the ASDS there, members of the State Medical Society came and joined me. We went over with them how we got this done, what the regulations were. And the Senate in France passed some of those a year or two later. And so some of what we did in Maryland is now the law in France. Really interesting how things happen. But that's how you get involved. And I suggest starting on a state level. That's the easiest way. State legislators are much more accessible. They're very easy to meet. They will be very interested in what you have to say, especially when it comes to something that is part of the whole House of Medicine that it approves. So you want to not do this yourself, like I learned. You want to do this as a group, as an organization, together. And the legislators want to help doctors. I mean, every legislator's got their own, but there are issues that every legislator will be happy to help doctors with. Tanning issue is something we've worked on in Maryland for many years, trying to get an under 18 ban in tanning. And we had a legislator for years so happy to sponsor our bill in the Senate and another one in the House of Delegates in Maryland. We had problems passing it because one of the chair of the Senate committee that heard our bill was against it. He had problems with it for business and he had ties to the tanning industry. But anyway, that's beside the point. But we had people who stepped up for us. But that senator may not have been supporting me on another issue, but he was there for us to help us on tanning. You know, what's interesting too is that when you work with these senators, and I would suggest you also go to fundraisers of them. And in the state level, a fundraiser, just go to a fundraiser for $100, $125 donation. You get to know these people. Relationships I've developed with these people last years and years. That state senator who I worked on for years with tanning and is such a nice person. He was not necessarily with us on tort reform, but he's actually now a U.S. congressman now. He ran in Congress, and what's interesting is because he was not such a big promoter of tort reform like we wanted, the House of Medicine didn't support him when he ran for Congress. The House of Dermatology did. My national dermatology organization, because of what he'd done for tanning, supported him. We were the only specialty that supported him when he ran for Congress, and he remembers that. I still have a relationship with him to this day, but in Congress, not on the state level. But I have many relationships still on the state level with members of the House of Delegates and state senators. And you build on relationships. You go to fundraisers, but you also see them when you have your issue, when you go to the state capitol to lobby about your issue. Relationships mean a lot. So it takes years to develop. But being an advocate means, okay, you can donate a little money, but it means going to things, going to fundraisers, making relationships, cementing relationships, and having issues and joining with the House of Medicine. I think that's how things get done on a state level. And I think that's the easiest way to start. So I guess the first way to start is to become a member. We dermatologists need to be members of our national dermatology organizations, our state medical societies, and lastly, I think the American Medical Association as well. Those are a lot of dues, but let me tell you, the attorneys are paying much higher dues, and the plastic surgeons are paying probably much higher dues as they seek to go their agenda, and it's not always the same agenda that we have. It often is, but so we have to be vigilant, not just within our specialty, but also in the House of Medicine in general. But we want to work together, but to become a member, that's the first step, becoming a member. Once you're a member, go to meetings, meet other doctors. Meet other doctors in your county and your state. Do free skin cancer screenings a lot of states have free skin cancer screenings once you're in the state capital. Do that. Take half a day off and do that. You'll develop relationships with not just legislators, but also their aides. Aides are very important. The legislators on both the state and the federal level listen to their aides. So it means taking time off work. It means joining organizations. It's not a lot of time. It's not a lot of money. But believe me, if we don't do it, other people are doing it, and we're going to become part of the menu. That's how you start to get involved. Dermatologists aren't on an island. We can't be on an island. We have to work together with all of us together, and also with the House of Medicine. That's when legislators listen, working with the House of Medicine. So that was my experience on a state level. What are things that happen on a federal level? We lobby in Congress every year. I lobby with both the AMA, usually once a year, and with my national dermatology organization, the American Academy of Dermatology Association. I go twice a year. Again, the more you're there, now it's easy for me, I live in Washington, D.C., but to go on a federal level, but there are fly-ins for the AMA and there are fly-ins for the AADA, where they'll pay, if you register early enough, to fly you in and to get your hotel so that you can speak and develop relationships with your congressmen, senators, their legislative aides, so that we can advance our agenda. But I like going with the AMA as well because I want the legislators, to see that I'm part of the House of Medicine. We are in it together. I think that's very important, and that's why I think it's very important to support the AMA. In fact, the AMA itself, our dermatology delegation is, the size of it is determined by how many members we have in the AMA. So the more influence we have in the AMA, the more influence we have with the House of Medicine in general. And there are a lot of people who disagree with what the AMA does and their stands in the past. The past is the past. The reason the AMA takes these stands is because there was not enough dermatologists stating their case. If we're there, that wouldn't be necessarily the stance of the AMA. So the only way to influence is to become a part. Again, I go back to it over and over. If you're don't have a seat at the table, you're part of the menu. And that's why it's important to be an advocate again. So federal level, I think it's very important to support our lobbying effort from a dermatologist point of view. I mentioned the AMA. I just say to be a member of the AMA. That'll help dermatology in general. But give to SkinPAC. SkinPAC is our national advocacy lobbying arm. That money that we give goes to legislators who support our agenda. SkinPAC will only give money to people who support our issues. They have a scorecard that's made up, looking at our issues, whether it be tanning, whether it be truth in advertising, whether it be prior auths, helping ease the burden of prior authorizations, whatever it may be, or working on the 25 modifier, whatever it may be. SkinPAC keeps a scorecard. And the more checks you have, if you're a congressman or a senator, the more money that SkinPAC will donate. So we want to encourage legislators as dermatologists to support our issues. We'll see when they support our issues, we can give money to them. If they don't support our issues, they won't get money from us. So this is happening everywhere, don't get me wrong. the more, all other physicians are doing it, all the lawyers are doing it. So these congressmen and senators are getting donations from lots of people. But the only way to stand out is to still do it. And they'll listen to us. And once we have their ears, you never know what's going to happen. We may prevent something from happening to us, like the 10-day global period change. I mean, so if we have the ears of congressmen, we were able to stop. We stopped that 2 years ago temporarily, or 3 years ago. If we didn't have their ears, who knows what would have happened? So donate to SkinPack. Become involved. Come into the ADA legislative fly-in day every year, so you can meet with your congressmen and senators. Like I said, I do that every year. It's easier for me because I live in DC, but the AADA will help pay your hotel and part of the airfare as well if you register early enough. That's what it means to get involved. And then whatever's on your mind, if it's not part of the ADA agenda or not part of your state medical society or state dermatology society's agenda, let them know. I mentioned getting involved in the state medical society. I neglected to mention your state dermatology society. That goes hand in hand. That state dermatology society is your first line of getting involved with your state medical society and getting the state medical society to support an agenda that helps dermatologists and our patients. So that's very important as well. So I would want everyone to get involved. I mean, I think it's very important. We can all make a difference together. But remember, you get involved on the state level, federal level. I think it's easier to get involved in a state level. And you can also get involved in the regulatory level. When you work with your organizations, you may end up speaking before the Board of Physicians or speaking before CMS or the FDA. So that's when you get involved, especially if you're very passionate about an issue that you started, that bothered you, that you were able to make change and get your state medical society or state dermatology society or your national dermatology organization to support. So those are all very, very important things. And I think things that help us to be effective advocates for our specialty. Very important. So I'll open it up if you have some questions, if I didn't answer your question well enough. And let me know if I didn't explain things well enough, and we'll take some questions.
I do have one question, it's kind of off topic. How does advocacy play a role in clinical trials?
Advocacy doesn't directly play a role in clinical trials. That's a whole nother topic. Yeah, we can have a whole water cooler session on that, to be honest with you. But clinical trials are a different thing, and advocacy is not directly related. But how you do clinical trials and how they're formed, I mean, there are regulations, and I mean, how they're organized. There are regulations on that that can relate to advocacy, but not directly. But how to get involved in clinical trials, how to do clinical trials, a whole another water cooler session. We could spend another hour on that, and I'll leave it to that. But I wouldn't say they're directly related, really, just other than just how you do the clinical trial itself.
Okay, that makes sense.
Yeah. Are there questions you can think of? Did I explain things well enough?
Yes, everything was very clear. I don't have any other questions. Okay,
so let me summarize, everybody. And thank you for listening to this archive tape, and I hope it helps. There are so many things that affect us as, dermatologists, that having a shift work mentality will get us nowhere. There are things like step therapy, pricing of medications, prior authorizations, public health issues, a white hat issue like tanning industry, preventing tanning in minors, allowing children to apply sunscreen in schools. We have issues like truth in advertising, scope of practice, tort reform, 25 modifier issue, compounding, keeping our global surgical periods, the regulations imposed on us with MIPS reporting and through the new MACRA, as well as electronic health records. All those things affect us. And this is just a tip of the iceberg. And things will continue to affect us that we can't even see happening. Things will come that we can't even see happening. We have non-physicians practicing medicine. We have nurse practitioners who now can practice independently. We have lots of dermatologists who really aren't dermatologists, who aren't board certified dermatologists, who aren't qualified as dermatologists, saying they're dermatologists. all these things are happening. We want what's best for our patients. So it's important to advocate. And I think it's most important to get involved. Pay your dues. Get your membership dues done. State Dermatology Society, State Medical Society, national dermatology organizations, even the AMA. I think very, very important. And then once you're a member, take part, participate, speak what's on your mind. You know what? Other physicians, non-dermatologists, are empathetic. They feel our pain. I've learned that over and over. They're with us if we let them know. They don't know. It's easiest to start on the state level. But join our national advocacy campaign for our dermatology society. Give to our PAC, skin PAC. Get involved in our AADA fly-in day. You'll establish relationships that can last years and years, not just with your fellow dermatologists, but also with people on the Hill. And stay involved. It doesn't necessarily take that much time. You can pick and choose what you want to do, and I suggest starting in the state level. But that is, I think, how to be an effective advocate for us as dermatologists, and it's very important, and it needs to be done. So if there's no further questions, I'd like to thank Equa Marketing again for sponsoring this water cooler series. I can't thank you enough for giving me a chance to speak and do this conference. Our next conference will be January 7th at 8 p.m. And I look forward to more people coming and listening live rather than just being archived. So thank you very much.